Hi, everybody. Everybody hear me? Everybody see me okay? And can you see my face in the top right-hand corner of your screens?
Yes.
Yes.
Okay.
Yes.
Great, great. Today, thank you very much for bearing with this. It was a long session already before this, but you guys are so awesome and have done such amazing things and are continuing to do them. That, time just flew. All right, we're going to talk about custom homeopathy kits. And the reason I wanted to do this topic was every one of you has different issues. We all have different issues in life. We have children who have different issues. We have pregnant moms. We have people with heart disease or diabetes or multiple sclerosis or Alzheimer's, or people who get into accidents, or youngsters who are playing constantly and break their bones. And so I get asked time and again, what should I do when the emergency has hit? And folks, that is not the time to get your remedies. The time to get your remedies is to anticipate, get your remedies in advance for your kind of children, your kind of spouses, your kind of family, so that you're adequately prepared. The goal here is never to have to go to a doctor for acute and many chronics. The goal here is never to have to go to an ER. You know what happens in ERs? Most often people come out more deader than alive, unless of course you've had an accident. The goal here is to have confidence in yourself that you will be able to take care of your loved ones without too much trouble, with the use of a few little pills. And with that, we will go to our next there. And a lot of things go wrong, and a lot of things could go wrong, and a lot of things that go wrong we never anticipate. But what thinking about homeopathy is going to do for you is to function as a preventive, as a sort of prophylaxis, pre-preparation, if you will. Does anyone remember what PPP stands for? Anyone take a guess what it might be? Proper prior preparation prevents piss poor performance. And so it is super, super important that you take the time, especially if you're responsible for your pets. You feel responsible for, your class, your schoolmates, your cousins, your friends, your family, and think about what could go wrong and have certain remedies on hand. So the key thing here is to anticipate, get the remedies in place, and then the actual event happens. You don't lose your mind from panic. You don't say, oh my God, what was the remedy for an injury again? Yes, arnica. You are well-versed in treating some of these things yourself. And then post-event is when you jot things down. It's a good idea to jot things down and say, Ipecac worked, Veratrum did not, or Veratrum worked and Podophyllum did not for this child. For this youngster in my life, or my pet, my dog benefited from this particular pneumonia treatment, but not the other. And therefore, thereby, you're collecting your own repertory, if you will, of homeopathic events that you have treated successfully. If you have questions, please interrupt me. All right. One of the problems with our current life is we prescribe molecules. We prescribe molecules that have been patented, molecules that are unnatural to life, and without exception, I guarantee you, these serve to decrease our lifespan. So you might get a person to stop bleeding with a certain drug, but they're going to die faster. You might get pain to go away with a Tylenol or an aspirin, but it'll come back to haunt you time after time after time. You might take steroids to suppress your immune system temporarily so that you don't have that inflammation, But guess what will happen? You're driving disease deeper. Antibiotics are going to wipe out your immune system. Your immune system is located in your gut, where you have gut biota, which will get destroyed by antibiotics. And they provide you everything from immune support to short chain fatty acids, to your vitamins, to your neurotransmitters. One dose of antibiotics, one dose of chemo or radiation or vaccines is going to do immense damage to your immune system and suppress it. So there's a distinction you want to make between suppression and cure. You're panicking in the short term, you're suppressing it, and the long-term cure is delayed, or the person ends up getting more and more chronic disease. So you suppress an asthma with one of those sprays, you know, epinephrine, norepinephrine, and the asthma proceeds to get worse and worse, to the point of killing you. In the old days, when they did not have those sprays, people got asthma, but they never died from it. It's only in modern day technology, the science and the technology that we practice in the modern day, that children are dying from asthma, because we're not letting their bronchioles take close. The bronchioles contract for a very good reason. They're healing, and it's a body's adaptive response to stress, asthma. So you want to let it run. You want to let your immune system handle it. And what homeopathy is doing is, it's literally doing the same thing that your immune system is doing. It's causing the same effects in the person that your immune system is doing. So when you're bleeding, we give homeopathic remedies that are similimums. So you give a similimum, a remedy that in its gross form, in its herbal form, in its real form, is going to cause that bleeding. But in its homeopathic form, it will help the body stop the bleeding in a very curative fashion. Are you with me?
Yes.
Yep.
Hey, you've not gone off for a nap, Lamb.
No, I'm still here. I'm intrigued by this. Yes.
You're intrigued. Okay. And so the question that begs is, what do I do practically? This is a lot of theory, and I get it. And I'm faced with a problem of a sick parent or child or spouse or dog or cat. And when they hurt themselves, I don't know what to do. I cannot tell you how many. I have dog clients and I have cat clients, and I cannot tell you how many of them panic when their dog stops peeing or gets paralyzed. They go to the ER, and within 7 days, the dog is dead. Twice now, it has happened. And they have insurance. So insurance pays for all these things. Insurance does not pay for homeopathy. And so even though you might be spending $700 per month on insurance, and you might have to spend $20 on homeopathy, people have an incentive to use the system as set up for them. And what the system is doing is it's devised to make you keep coming back at more and more expensive rates. And that would be okay if you got well. The problem is you get sicker. That is the problem with our system. So what you want is custom kits. And I've done a few, but we can do them as we speak. This can be a discussion. You guys decide, you know, you can make custom kits for dogs and cats and kangaroos. I have a dog who has a little cancer on her jaw. She needs arnica, she needs hypericum for the pain. Sometimes she's prostrated, so I give her carbovegetabilis. Hecla lava works very well for jaw growths in your jaw, so I have Hecla lava. Amphisbaena is a lizard poison that works very well in the lower right jaw. And so I have that in small potency and large potency. So my Roxy's kit and Kali iodatum for swelling, and Merck for a stinking ulcerated tumor and digestive issues, Merck, Sol, and Belladonna. And so that is my dog's kit. I just keep it outside. I keep these remedies in a little box or in little syringes or little bottles, and that's Roxy's custom kit. You might have cats that throw up a lot, or cats that tend to have more diarrhea. And you want to keep a set of remedies that are special to these animals, or kangaroos, or children. My older daughter, Katie, has a different set of issues, In the same illness, my older daughter used to have different symptoms than my younger daughter. And so will your Johnny, or your brother, or your sister, or your child. If you are a senior citizen, there are specific symptoms you have. I see a lot of arthritis. I see a lot of, pulmonary disease, or mobility type issues, or falls and injuries. And so that's a separate kit. There's back injury kits. There's depression. You have a person in your life you're taking care of. It's a lot of caretaking. Cocculus is a great remedy for people who are caretakers, people who are every day seeing their loved one dying, depression, grief, etc. And so, or migraines. There are people who tend to suffer from migraines. You want to have belladonna for a throbbing migraine. You want to have bryonia for one of these intense sort of semi-right-sided pains. If it hurts in the back of your neck, you have the nape and the occiput, that's called the occiput, the back of your neck, then you want to have gelsemium in your kit. If you get migraines where you see ziggy-zaggies and flying crackers, iris versicolor is your remedy. If you're a young person who is prepubescent and getting into puberty, and you start to get these hormonal kind of migraines of school children, Nat Muir is a wonderful remedy that'll make it all go away. Any questions? No questions. People have UTIs, urinary tract infections. You want to have Staph aureus, Amatorinum, Cantharis, Apis. These are standard Berberis, Equisetum, Subalcerulata, the tincture. And these are classical remedies that will ensure that your problem just does not expand beyond a minor illness. Pregnancy, postpartum, and lactation. I cannot tell you how many C-sections we would have saved had we had pregnancy homeopathics administered. For babies that were breech, pulsatilla has been known to move them around and engage in the right position. Postpartum, lactation issues, a child, pain and trauma to the child, screaming children, on the first, second day, they get their Hep B shots and they're screaming their heads off. Chamomilla, it'll deal with some of the vaccine damage as well. Or colic, colocynth is a great remedy for child's colic, pregnancy diseases or nausea of pregnancy, vomiting of pregnancy, tobacco, petroleum. So if you have these kinds of custom kits, you'll be prepared. So to go back, you want to be anticipating what could go wrong. You want to do it by the person or animal or plant in your family. And then you test it against actual events. To, I think, Shanti's point, homeopathics didn't work for her. So you want to examine and see what worked and what did not. Why did this remedy not work? What was the actual symptom? And you'll find that as time goes by, folks, you get better. For Johnny, this particular, for Seema, pulsatilla works well. For Katie, it might be Nat Muir that works well. For Johnny, it might be Aurum metallicum that works well. And you find that it's sort of leading you towards their constitutional, the remedy that makes everything better.
May I add, may I say something about having a baby that's in breech position? When I used to teach childbirth classes, I had one class with 3 of the pregnant women having their babies in breech position. So we investigated and we found that by squeezing both sides of the, on both feet of the little toe nail, you squeeze both sides, all 3 of the babies turned.
Wow. Who knew? Who knew? That's awesome. Yeah.
So you squeeze the little toe, toenail on both of the feet, and you do that. But you also have to talk to the baby and say, if this is what is best for you. You don't want to force the turning. Yeah.
Oh, that's wonderful. And that's such an emotional event. It is so guided by a woman's heart, emotions, and hormones. we forget it at our peril. We forget it at our peril. It's not a cut and burn removal of a baby from the mom.
Right.
So that's excellent. Chronic disease. If you have certain kinds of diseases or certain kinds of conditions, you want to have a custom kit. And I'll go through a few. Alzheimer's, you name it. If you can think of others, let me know. But I started with a few. And so someone with a heart issue, if you feel the left side of your body funny, left pains and aches, numbness, tingling, heart issues, thumping, palpitation, you want to have Arnica montana through your 6X on hand. You want to have, if you have cramps in your chest, magnesium phosphoricum 6X is a wonderful remedy to take twice daily. And if you have arrhythmias, heart weakness, cratagus, which is hawthorn, and tincture form, and homeopathic tincture form is a wonderful remedy to keep on hand. If you have irregular vascular supply, see kale, cornutum 30C is a wonderful remedy to have on hand. If you have low heartbeat, digitalis, homeopathic. If you have an emergency, you are panicking, your spouse or your significant other is in great pain, you're rushing them to the emergency, by all means take them to the emergency. Administer aurum arsenicum at 200 every 30 minutes, followed and then follow it up for 2 months with the same remedy. And in the cardiac emergency, you can give them arnica. Everybody should have an arnica on hand every 30 minutes, along with aurum metallicum, aurum arsenicum. It's hard to find aurum arsenicum these days, but if you have these, you're equipped. So what it's giving you is confidence, a sense of control, and that alone is going to alleviate half your fears. You're going to have remedies that help to ameliorate your symptoms. You're going to have remedies that address each of these issues, and there's lots more. There are many, many, many more heart remedies, but these are a few that you should have on hand. One of the things we're told by doctors is to take aspirin to thin your blood. Aspirin is extraordinarily hepatotoxic. It's toxic to your kidneys. It's what causes the secret killer, which is kidney disease. Before you know it, you've been taking a baby aspirin for 10 years, along with a statin, and your kidneys are in stage 4. And they're waning rapidly. You're down to 10% before you even figure out you have kidney disease. Swap that out with arnica for pain, for vascular rehabilitation, for dealing with cramps, for angina pains. For angina, semicifuga is great for chest pains, heart pains. Digitalis for dysrhythmia. Sea kale for any kind of blockage prevention and to correct your circulatory imbalances. And once you start taking these remedies, I guarantee you will become intuitive about what you need when. Your body will tell you, I need an arnica. I'm getting these pains. I can eat cayenne pepper. I can take semicifuga. I can take magphos. Where you've got thumping heartbeat or low heartbeat or bradycardia, which is low heartbeat, digitalis is amazing. To strengthen my heart muscle, I need to take a couple of drops of cratagus daily or infrequently. For blood pressure too, Lori, you were asking. This is a young person, so probably not the same problem. But if you have a true heart condition, cratagus is amazing. Frequently, heart disease is accompanied by depression or, just nervousness. Life events cause a lot of these things. Aurum metallicum is great for that. And in the event of an emergency or cardiac arrest, aurum arsenicum, arsenicosum has been known to completely roll it back. And by all means, you can go sit in the parking lot of the emergency. But remember, you're going to spend 12 hours there. They're going to hook you up to every kind of medicine, dyes, fluorescent dyes, which are extraordinarily toxic in a person who's already compromised. And if, as a result of doing these things, your heart rate becomes normal, things become okay, you go back home, you examine your life, change your lifestyle, do whatever you need to do, and you get better. You get better. They say the heart muscle cannot regenerate. I beg to differ. I've seen people who are told a lot of this do very, very well for years and years and years afterwards, purely on food and homeopathy. And there's a cool kit picture. So you can, it's like a CD case, but with elastics in it, and you can have your little custom kit. I would recommend an aluminum foil wrap, a Faraday cage for your kits when you travel, but they work no matter what. If you have heartburn's causing you heart issues, NatPhos 6X is a wonderful thing to have on hand. So Tori, that's a wonderful thing for you to keep. Robinia, if you have ipecac, that's pneumogastric, your pneumogastric nerve, the parasympathetic nerve that runs through all your organs, ipecac is a medicine, a remedy that acts upon it. So for folks who, women in particular, tend to wake up in the middle of the night with a thumping heart, frequently it is pneumogastric. It's gastric issues causing heart issues, and ipecac works like magic for that. Arsenicum, also another good remedy. So if you want to make a heartburn kit, start with those 4 and add to them. Questions?
I have a question. You gave a specific dosage for NatPhos. On some of the others, or in some of the other examples, you haven't given that. Is that left up to our own intuition, or are there further guidance for it?
Further guidance for it, but you can do anything from 6 to 12. I would say 12 or 30. Go with either 12 or 30 for the others. If I don't say it, go with the 12 or the 30.
Great, thank you.
So I've got a question as well, if that's okay. How do you know, or how long do you give a remedy to work? And can you do any harm if you get it wrong? Because I guess my confidence, do you keep going for a couple of days with a remedy just to see if it works, or is it a couple of hours and it's not working, you try something different?
So in an acute, you'll know right away if you feel better. As soon as you start feeling better, you stretch it out. So if you were taking it every 5 minutes and all of a sudden you're feeling better, take it every 10 minutes or every 2 hours. If the problem completely stops, then you stop. If heartburn is a recurring event, then you take NatPhos before each meal for a few days. And then once you don't get any heartburn, you try a day without taking it. And if it continues to be okay, then you stop. So there's no such concept as a course of treatment in homeopathy. You feel better because all it is it's stimulating your own system to do what it needs to do. And as soon as your system gets beefed up, you get out of the way. And it'll come to you naturally after a few shots.
So if it's something chronic, would you give it a couple of days to work?
Yes. Let me tell you, something that's been going on for the last 20 years, you're not going to cure in the next, and especially functional damage, organ damage, you're not going to heal it in 2 days. And for that, you have longer term protocols. You increase the potency. As one thing stops working, you go to the next higher potency. But you don't change it if the symptoms don't change.
Okay.
You see what I'm saying? So if you started with shortness of breath and Kali Ayod worked for a little bit, and then it stopped working. Then you say, gee, it stopped working. What's happening to me now? Now I have troubles with inhalations and I feel oppressed. So you look at the remedies for that and you go with that. It might get better, it might not get better. If it gets better with that remedy and the symptoms continue to persist but less frequently, then you go for the higher potency remedy. So you might go for a 36 to 12 to 30 to 200 to 1M to 10M to as much as 50M. And your Helios carries all those remedies.
Question for my reminder and perhaps everybody's edification. Can you explain again the difference between X and C remedies?
Yes, X are much, much lower potency. They're diluted only 10 times each time, 10X, 10X, 10X. So you take 1 drop of the tincture, put 10 drops of water. that's a 10x dilution. If you take 1 drop of tincture and put in 100 drops or 99 drops of water, that's a centesimal or 100 cx or 100 c. 1 c, that is 1 c is 100 times dilution.
Right.
And if you do it, 1,000 times, that's a 1m.
Got it. Thank you.
Yeah.
Yeah, one question I had is, in case of acute illness, at that time, as you are saying, any of those medications, I don't remember the exact names, but like, suppose if it is related to the heart, then should we give the water dose or straight the pill, which is better in that?
Water dose is gentler, but if you are in an emergency, stick the pill. If people are in coma, I've seen or read of tales of people coming out of coma with arnica under their lip, or even olfactory. You put it in a little spray bottle and spray their nose with it or something. Anything will work. Whatever you're able to get into that patient is a good thing.
Okay, thank you.
And the other thing I wanted to say about chronics was typically you give remedies based on the person's susceptibility and strength. If the person is very weakened, you don't want to give them 201 potency remedies. But at the same time, there are instances that call for it when there's enough of an emergency. But generally for chronic disease, you start with lower remedies and they will help. For acute, for children, if they're in distress, high potency remedies are good. If a child is having diarrhea every 5 minutes, podophyllum 200C. Administer it as frequently as every couple of minutes. Under the tongue, spray it, stick a pill under their lips when they're asleep, whatever works. All right.
Okay.
Further question. I've heard you say several times as a guideline to start, I mean, this is very general, but to start small and then to go bigger, depending on, the number of times you take the dosage and so on. You've also cautioned us, I hear you, about doing something that's like an M dosage for like you need a C. What I've heard that homeopathy is gentle, but what does that mean if you take something that's too powerful for what you have?
Right. So if you take apis, the remedy for, say, hives or swellings, and you don't have a hive or swelling, you can actually prove it, meaning you can get symptoms as if you got bitten by a bug. And that's called a proving. And so that can happen, but it's much rarer than allopathic medicine, which is actual gross molecules of medicine. And the effect goes away fastish. So homeopathy is the one thing that mothers, family members can apply without too many problems. The remedies are polycrest, meaning they act in a number of different ways. So if a person is not well and you don't quite get the right remedy, but you get a remedy which has some of the effects of that condition, it will address it. It'll make it better. So I would say homeopathy is one of the streams of medicine you have to worry the least about in terms of accidental overdose. Children love sugar pills and they've been known to eat entire bottles, and it's one dose. Nothing happens. They just go right on playing.
So to carry on just a little bit more, the example I gave, if my body calls for, say, a 60 or 20 or 30C, and then I take a 1M or a 5M, does that make my symptoms worse? Or what does that mean? What happens?
It will have a bigger field of action. It will have a bigger degree or circumference of action if you take a 1M. And if it has that condition, it will actually cure it faster. So if you're certain, that's another thing, collateral rule, that is, if you're certain, take it in potency. If you're certain of what ails you, if you know you have an injury and a big black and blue bruise, it doesn't hurt to take arnica 1M. It'll have a far faster effect than taking smaller amounts of arnica. On the other hand, I've seen people for whom 30x works the best. And so that is why it's very customized. And you as an observer will see how it works on different members of your family.
Sushma,
Yep.
where does rescue remedy fit in with like a accident? injury?
Here, great remedy. Rescue remedy, Traumeel, under accident and injury.
Okay, thank you.
And it is a combination of many of these. Maybe it has gelsemium or something else as well. But arnica, hypericum, rust, arnica for injuries, bruises, hypericum for nerve pain, rust for cartilaginous and fascial injuries. You know, you hit your back. Symphytum for bone injuries, and periosteum, the cover of the bone. You whack your tailbone. That's symphytum and arnica. Instant results. Ruta for wrist pain or writer's cramp, or you know, typists, or people at Pixar who are making pixels of little cartoon characters. Ruta is something the companies need to issue to these people. Thiocyanamide is for scar tissue, to take away the effects of the scarring left by the injured tissue, which actually has a huge impact on how your meridians work, how the electricity in your body, folks, travels on your fascia. And so you want your fascia to be smooth, like good wires, and for the scar tissue to be taken away. And you can take away scar tissue with thiocyanamide or fasting. Your body mops up the scar tissue. So if you have had an injury, by all means take a low dose of thiocyanamide and then fast for a couple of days, and the scar tissue will get munched down by your body seeking extraneous proteins. Aconite. Many mothers forget to take an aconite. Guys, this is an oxygen mask. If your child bleeds, falls down, hits their head, there's a sea of blood around them, first, take an aconite yourself. You don't want to faint while that child is bleeding to death. So take an aconite yourself, pop an aconite under the baby's or the child's tongue, give them an arnica, and then look at the wound and clean it up. Natrum sulph. This is an excellent remedy for concussion. You fall down on the back of your head on ice and snow, and you've never felt well since. Take natrum sulph in increasing potency if it doesn't work in smaller ones. So it's if you have had, so I would recommend for you, Tori, 6, 12, 30, 1M, 10M even in natrum sulph if you have persistent problems related to the head from the accident or injury. Remarkable results. And if you take them now, 20 years from now, there will not be collateral problems. If you take arnica now to mop up the blood in your wound in your brain, you will not have hematomas and thrombosis and strokes 15 years down the road. Super, super important. So that's your custom accident and injury kit.
I have a question.
Mm-hmm.
That's regarding this thiocyanamide.
Mm-hmm.
You mentioned it's for healing scar tissue.
Yes.
So will that also be helping out for an episiotomy scar?
Yes. On your perineum.
Out fascia, yeah.
Oh, yes. It's routinely given to women who've had episiotomies. One of the most unnecessary techniques that was done on me. It hurt like hell. And, you know, thiocyanamide will completely heal that scar. 3x.
3x.
Mm-hmm.
And again, it should be water dose?
Yeah, I would take it in a water dose, but if you don't have time, take a pill.
Because mine is like now 8 years old. It's
Yes.
bad. For
Yes.
2 years, I couldn't sit in a cross-legged position, taking weight on the side. And it had been bad right for both the deliveries, actually. So a water dose 3 times a day.
Yeah, 3-4 times a day until much better. And
Okay.
3x, you can get 3. I know you get 3x in Europe and in India. I don't know if you get 3x here. But thiocyanamide, the lowest dose you can find and take it, I just chug it, 4 times a day.
Okay, thank you.
And I cannot say enough bad things about episiotomies. Women who had perfectly normal pregnancies were delivered. That 20 years ago, it was high fashion to make a cut, whereas a tear heals much faster without the scarring, without the pain. It's mad, it's insane. Any other questions on this? No questions. All right, travel. You've traveled with your family. Every time I go to India, I drink the water and something happens to me. So I have my arnica, I have my bryonia, or rather I make my daughter keep it for me. Bryonia, aconite. If you are vomiting from one end and have diarrhea from the other end, and you're completely prostrated, Veratrum album is your remedy. If it is watery, gushy diarrhea in summer, Gambugia is a great remedy, especially in the tropics. If you're completely, your child's eyes are closing, they're feverish, they can't open their mouth and they can't talk, Gelsemium is their remedy. If their eyes their pupils are dilated and they have very high sudden fever and their faces are bright red, that's belladonna. Beautiful lady. And that is a homeopathic remedy made from deadly nightshade, which in its gross form will kill you. But Italian women used to put a tincture of this in their eyes to make their pupils dilate. Did you know that? And that made them beautiful. I probably made them blind too, but who cared? So that's belladonna. If you get seasick, if you get car sick, tobacco and petroleum are great remedies. Take it right before you give it to my grandson. If he's facing away from the road, like the car seat that was reversed, invariably he would hurl in a car. And it was not pleasant, let me tell you this. So petroleum and tobacco will work wonders for that kind of puking in the car. Hurts, so travel, you get hurt, you get traveler's diarrhea, you get flu, you get you're wandering about in a forest and you get poison ivy, poison oak. Anacardium is great for that. China, you're losing body fluids, Cinchona officinalis. If you have a sore throat, Merc-Viv. If you get a bug bite, Apis, or if your body swells up, it's Apis. So you can create your own custom travel kits based upon what your kids have. You don't have to have everything under the sun. You just have to have whatever ails your child number 1, child number 2 or 3 person. Some people get backaches when they travel, so make a backache kit. Some people throw up, so make a throw up kit.
Question. I don't have any young kids of my own. I'm surrounded by the young kids though. And my question is, if you don't have the condition to know which of the remedies work or help, how would you know in advance what to choose?
You take a few generic remedies that are like, which is why I have this PowerPoint. You choose these because typically travelers get intestinal distress, because now your circadian rhythm, your liver is moored in California and you've gone to India 12 time zones away and your liver doesn't know how to digest food anymore. And so you get diarrhea, new bugs, your body's stressed, fevers, colds, flus. So custom travel kits, I would include fevers, colds, coughs, diarrhea, vomiting, and injury.
Okay.
Yeah, take a guess, you
Yeah.
might be dehydrated, you might get a kidney infection. So take Metaurinum and Staphysagria and Cantharis and Apis,
Okay.
So anticipate. And if you take a few extra remedies, it's not gonna kill you. Now, my daughter, when she was going from France, I had given her all sorts of remedies in Paris. And she said, Mom, you're just filling me chock full of remedies. I don't want to take any one of them. It was all I could do to give her the 100 remedy kit. And that's coming in very handy now. But I wish she had taken the 200C remedy kit because they really need it. And when you need it, you cannot mess around. You cannot go out and drive 3 miles or 4 miles or 20 miles to get your remedy. So more is better in this instance. Redundancy is better. If you think you need 3 diarrhea remedies, get them, even if you never use 2 of them again. All of this will cost maybe $100. It'll save you thousands of dollars in hospital costs and IVs and this and that, and you know, and distress, mainly distress.
Great.
All right. Coughs, colds, and fevers. Aconite is a #1 remedy for sudden fevers, from cold, from chill, from dryness. So by all means, give your child aconite. If you have nothing else, just keep arnica with you in your purse, you know, or in your bag, or in your shirt pocket. Belladonna for children's fevers in particular, it's magical. A child goes from 98 to 99 to 103, and then the mother is on tenterhooks. She's terrified that the child will start seizing. Belladonna. Bryonia, when the child doesn't want to be touched, just wants to be left alone. Calicarb, when they're coughing a lung out. Gelsemium, when their eyes are almost closed or they're very anxious. And Ipecac, when they have nausea. Veratrum, when they're doing it from both ends, pouring out from both ends. Phos, if they have pneumonia, generally works very well. Phos and high potency, I would keep, given this incidence of COVID and such, you know, panic-laden pandemic type diseases, I would keep Phos with me for respiratory diseases. Phos 1M. If you get sudden inability to breathe in the course of an illness, Phos 1M has worked miracles.
You've mentioned the application for children or for adults. Is the dosage generally different or not?
Yes, much lower doses. 6 Cs for children, as much as possible.
Okay.
But that is not to say you don't use a 200 if you have it. But 6X will work just fine for 6C. Will work just fine for kids. I should have added ferrum metallicum. In the early going, when things are just about to get started, you can abort a fever with ferrum metallicum. If they're throwing up occasionally, if the fever is starting, their faces are red, get a ferrum metallicum, ferrum phos. Allergies. You wanna, if you have allergies, seasonal allergies, keep a kit so you don't do steroids, so you don't do inhalers, and then treat the lungs so that the lungs really heal well. So these remedies that I have, allium cepa is for a runny nose, which is acrid, so it burns when it runs. Euphrasia is for runny eyes, you know, and bland discharges from the nose. If you're sneezing a lot, keep arsenic amalgam, 3C, works like magic. Histaminium is another great remedy. Ambrosia, very good for hay fever. I would do it in 200 potency. Sanguinaria, if you have stuffy nose from hay fever. And Nux vomica works really, really well for children in particular. Stuffy noses, dry noses, where they're very productive during the day and at night they get dry and stuffy. So that's Nux vomica. And then you have asthma kids. We folks, because of the vaccinations in children, we have an epidemic of asthma in our children. Chronic diseases were 11% of the population, and now it's up to 64%, primarily from injecting willy-nilly all sorts of, you know, illness shots into a child at very, very early age. And the body does not know how to respond. The body responds by having this enormous cytokine storm, this enormous response where it's starting to shut down, and it manifests itself as asthma, eczema, allergies, and they can be rooted out with homeopathics. I've seen stunning results in vaccine damaged children with some of these remedies for asthma. Their autism symptoms go away. You know, they start looking at you in the eye. You know, if they had constant diarrhea, that goes away. Wonderful, wonderful results.
Question. I'm stressing or focusing on the difference between children and adults. I'm guessing because of maybe their underdeveloped immune system or maybe some other factors that children are more susceptible to more conditions than adults. Or is there some other factor which would say focus on this for children and adults?
It is toxic damage is universal and can happen at any time to anybody. Toxic damage expresses in children as diseases like chronic autism or chronic diarrhea or eczema and asthma. And in adults, the effects of those same toxins, because they're baked, they already have a good set of lungs, they already are able to walk, their brains are already there. It manifests itself as the Alzheimer's, the multiple sclerosis, the Parkinson's, the celiac disease, the Crohn's disease. And so we're finding that today in modern societies, we have children with these chronic children's diseases and adults who have been severely just drugged up or vaccinated up with these adult diseases that never existed in mankind before. But they are effects of the same set of drugs and toxins.
Mm-hmm.
So the same medicine in many cases will work for some of them.
So the symptoms may be different or manifest differently in children as in adults because of the history of life and in the ages of the two groups.
Yes, indeed. That's a very important point. And so what we're saying is, oh, you don't get diabetes as a child. But what we're finding is what people had in their 80s and 90s, what they had in their 80s and 90s 3 generations ago, started appearing in middle age in the last generation, and now it's appearing in little kids. Children are getting type 1, type 2 diabetes, type 2 and type 1 diabetes at birth, after their Hep B shot, after their DPT shot, after their MMR. And it's a tragedy. It's just a complete tragedy, because children are born perfect. Humans are born perfect because you have your genome and you have the ability to interact with your epigenetic environment, you know? And so nature made us really perfect, and you can see it in an unvaccinated kids. I kid you not, an unvaccinated kid will get a sniffle and in an hour they're back playing. Whereas if a child has a lot of toxic load, it's weighing it down. And so what you want to do is lighten the load with homeopathic remedies and with food. And it does get lightened.
Does the epigenetic influence work similarly for kids and for adults, or is there a different effect, or depending on what the environment is?
Similarly, before functional damage is done in adults, you can heal a lot. In children, the same thing. If parts of the brain are dead. Now, imagine if you had autism at the age of 6 months, it doesn't get diagnosed until 3 or 4 years. You've had all this time for your brain not to develop. And so it's very hard to turn back some of these effects from the ages of 6 months to 2 at the age of 5, if you see what I'm saying.
Yes.
But so parents need to be on the ball. And as you see damage happening, it behooves you to take action. Ask questions.
Thank you.
All righty. Arsenicum for suffocative cough, wheezing, which is worse at midnight. And you get asthma, which alternates with eczema. And so my brother actually got that. And so for him, arsenicum will and has worked well. And he used to sneeze a lot, so it's perfect. Spongia tosta, if it's a dry cough that carries on, and in some people it just goes on and on for a month. It's a kind of a cardiac cough. You have some thyroid problems. Warm drinks make it better. That's Spongia tosta. And I would recommend that for you, one of you at least here. Antimonium tartaricum is an asthma with loose, rattling cough. You cough up a lung filled with lots of mucus. It's very productive. That's antimonium tart. And in a certain stage of COVID, that was very useful for a lot of people I worked with. It would heal them like that. Ipecac and Sambucus nigra are wonderful remedies for asthma in children. Dulcamara and Nat Sulph when you get asthma in wet climates. In the great British wetness, here in the winter when it gets really wet and it's damp and it's raining and all of a sudden your chest fills up. Nux vomica is great for asthma in winter. Blatta orientalis, which is cockroach, is a fantastic remedy and with bromium for asthma that's triggered by dust exposure or other irritants, certain haze and pollens. So try Blatta and bromium. Carboveg and Seneca for asthma in the very elderly. Aconite and Apellis for asthma that worsens in cold air. You go into cold, dry air, all of a sudden you can't breathe anymore. Trigger aconite, instant results. And literally some of these acute remedies have instant results. Lobelia and Flata is for asthma and smokers, and it's a great lung wart remedy. And what the bronchodilators are doing is they're actually driving disease deeper. You're more likely to die. You're more likely to be hospitalized with bronchodilators and epinephrines, norepinephrines. Avoid, 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 because you're using steroids to shut down the immune system. And we have Banerjee protocols, which is what I gave to you, Tori, the Kali iode for the wheezing and dyspnea. Cal-carb, you can take ongoing, Cal-carb 200 with belladonna 3C and to root it out over time. It's worked for me, it might work for you. Ipecac is for a gagging cough where you go and then you're wheezing and you can't breathe anymore. And then that's extrinsic allergic asthma. And then for, I have repeated myself. So I'll go on to the next one. Skin symptoms. Antimonium crudum. Generally, if you have a skin problem, you know, you have a rash where the mask was. I've had so many people call me and say, oh my goodness, I have a rash where my mask used to be. On my forehead, down my nose, around my lips, and on my chin. Start with antimonium crudum 6C. If you get infections, arsenicum 200 plus Hapar 200 or alternate. Fantastic for skin infections, bacterial infections. Suppurations, if you have boils and blisters that are already suppurating, take Hapar 6X. It'll help to suppurate and heal that boil.
What does suppuration mean?
Suppuration means you have like a boil that's got pus in it and it looks like it wants to break, but it's not. When you give it Hapar, that'll ripen it and push that process along. And
Right.
so see what I'm saying? It's not drawing it up, it's making it come out. The key here is disease, your body's fluids, your diarrheas, coughs, vomits, sweats, pus are your body's way of getting junk out of your body as you heal. And what homeopathy is doing is giving it a faster gateway to getting out there so that you heal faster. Thorns and splinters, I've tested this on children. Silicea 6X works like magic. Thorns that you can't get to, glass splinters that you can't get out. 6X magical, within 24 hours, you get the splinter out. See that picture over there? Splinter out, 24 hours. Boils, if you get spider bites and bug bites and you get boils, tarantula cubensis is a magical and miraculous remedy. So that, yeah.
Question on the splinters, which I've had before. When you use the homeopathic, does it come out naturally, or does it produce from the skin so you use a tweezer or something to pull it out?
It starts to come out, and once the head is popped out, you can pull it out.
Got it, thanks.
And so, you know, I don't know what issues people have, but these are custom kits. These are just thoughts and ideas, guys. You can be creative. You can knock yourself out and make yourself a, you know, a stomach kit or a stomach flu kit or whatever it is. Childbirth. Every woman should go into childbirth with a childbirth kit. And this will really help you have a good, stress-free pregnancy that does not lead to distress in the baby, trauma, and then C-sections. The second you get an episiotomy in a pregnancy, in a birth, take arnica, take calendula, put calendula on your wound, calendula gel or something. Take it internally, eat arnica, take hypericum. Those wounds, those episiotomies hurt like hell. So hypericum for that radiating pain. And it'll cure, and Staphysagrina. any surgical incisions, you need Staphylococcus aureus, C-sections, episiotomies, and you'll find that you'll heal well. I should have added phosphorus for the effects of anesthesia and Novocaine and such. That's a wonderful remedy. So that's childbirth. You can have a diabetes kit with Zystium jambulanum to reduce your blood sugar, chelidonium to increase liver metabolism, Plumum metallicum for neuropathies. So if you have neuropathy from diabetes, try Plumum Met 30C 3 times a day, see what happens. Bryonia, frequently diabetics will have thirst with dry lips, constipation, they're very fatigued, that's bryonia. Uranium nitricum and nat sulf are for excessive urination in diabetes, so people who pee a lot when they have sugar in their urine. Helonias and creosotum are great for a thrush. You have too much sugar, you tend to get more yeast infections, smelly, yellow staining discharges. That's helonias and creosotum. And that is a diabetes kit. So be objective, be observant, and you'll do well. And typically you'll find that a diabetes patient, no matter what they have, if you give them one of these remedies, they actually start to get better because it speaks to their constitution. If you see what I mean.
Does this, the diabetes kit, the custom kit for diabetes, does necessarily work with diet? Or I guess that yet be another factor in dealing with that condition?
Oh yes, diet is the biggest factor in dealing with every condition in life. Diet and absence of toxicity. If you had diet and no toxicity, you wouldn't need anything in your life. Sadly, that's not the case. Then the Banerjees have come out with tissue-specific protocols. For the brain and the eyes, Ruta 6C is wonderful. Our kids have eye strain from sitting in front of computers for 14 hours at a time, you know, the young generation. Brain and eyes, eye strain, brain cancers. Ruta mops up lesions in the brain. So Ruta 6C and Calphos 3X are wonderful for multiple sclerosis, glioblastomas, brain cancers, spinal cord lesions, etc. Nitricum acidum is a specific for mucosal tissue, which is your mouth all the way to your anus. Any problems with that? Add nitricum acidum to your kit. If you tend to have heartburn, if you tend to have loose stools, if you tend to have burning pain, if you tend to have cancers. Hold on, let me shut the door. 1 second, please. Let's retrieve another phone call. Hepar sulf 6C is very good for benign and malignant tumors of the larynx. Who knew? Kali carb, if you have lung disease, and I would recommend that for you, Tori, 200C will over time confer resistance to many different lung pathologies over time. These are protocols that you take not for a day, not for a month, but for several months. If you have gluten intolerance built up from 10 years, Bovista 200C, taken twice a day or once every other day over many, many, many months will allow you to eat pizza, albeit from good sources, so that you are not restricted in what you eat, so that what you eat, you actually digest without bloating, especially children. Breaks my heart.
I have a question again. These are and we're looking at now homeopathics for specific or could be for specific conditions. How would one know if one has the condition, for instance, in the first place? How would one know has the cancer of the pancreas or cancer or something? How would one know that?
So I would say for these Banerjee protocols, please don't guess. Get diagnostic treatments, get diagnoses. That doesn't mean you also fall for the radiation and chemo. That means you get the diagnosis that are done with non-invasive tests, preferably, so they're not injecting you with colored and fluorescent and radioactive dyes. Diagnosis is mankind's and modern science's best contribution to humanity. So diagnoses are not allopathic. Diagnoses are good science that's going to tell you you have a pain in your belly because there's a golf ball sized cancer, or it's a it's a tumor that's growing, or you have an ulcer. So, or blood markers will tell you a lot about your blood sugar levels, kidney disease, and so on. So learn to go to these labs, get hair analyses, urine analysis, blood analysis. We've had a lot of meetings where we've talked about how to look at these and translate these diagnoses. But you got to be a very big part of it. You got to understand what a hemoglobin level of 6.0 means. And from that, you can pretty much get yourself the tissue-specific, condition-specific remedies. That answer your question?
Yes, but partly, but does that mean excluding things like MRIs or X-rays or other so-called semi-invasive ideas which identify, say, there's a globule in my intestines or my chest or whatever?
Right. You want to do a risk-benefit analysis on that. For instance, if you're not coughing, if you have no problems, there's no reason to take a chest X-ray. However, if you've had a cough for 6 months, I would go get an MRI.
Okay.
So it all depends on what the level of illness is, how you feel, and what you think you need to do. There's too much testing for non-diseases. There's this DCIS is the cancer in situ in breast, which is stage 0 to stage 1 cancer. That's not cancer. What we're doing today is over-testing and then over-treating people with therapies that are causing the cancer. So I know people who had this digital carcinoma in situ, which is typically your body clears those out by itself, and then they go in and do lumpectomies and chemo and radiation.
Right.
And the effect of those is cancer. So what you didn't have before, you're going to get now.
So another brief addition to that, just the other day, someone sent me something about a new diagnostic tool that is available to certain Western doctors, I guess anyone else. But it can create or make one aware of a 3D internal analysis or viewing of some parts of the body. I have no idea what the power is or what system it uses, but the doctor said, this makes, all these other tests that I need to do, this irrelevant. I can use this new device. Do you know anything about that?
No. If you don't have a problem, don't get the test.
Okay.
That having been said, some of the least invasive tests are urine tests. You pee, nothing, no skin off your back. More invasive blood tests. More than that invasive are the radioactive, the MRIs, the CAT scans. And the most invasives are where they take a needle, stick it into your tumor, they're pulling the needle out, and you have literally needle mark metastases, cancers coming out of that poor tumor. Your poor body went to great lengths to encapsulate that malignancy, and now you just opened it up. So it's just terrible. It's terrible. We know that needle biopsies in malignant tumors cause the cancers to spread, and yet we still do it. How stupid is that? That's stupid.
Great. Thank you for your comments.
All righty. Diseases of the liver. If you have cirrhosis, chelidonium, great success. 6x 3 times a day. For cancers of the pancreas and biliary tract, Cardus marinus is great. Disorders of the stomach, arsenic and the 3C potency is wonderful. And you will not believe how many other pulmonary and other skin conditions this will clear up. It's amazing what is connected to the gut. Gut health is true health. Thuya, occidentalis, first line against kidney diseases, kidney cancer, kidney infections, bladder, urinary tract. So these are very tissue-specific remedies that the Banerjees have used with great success, treating over 30,000 cancers to date now with very, very good results. And other non-cancerous conditions as well. All variety of skin disorders and rashes start with antimonium. If you are in doubt, follow the Banerjee protocols and see what happens. You'll get a little bit better, or you'll get a whole lot better. Bacterial infections, Hepar sulf 6C or in 200C, frequently combined with arsenic amalgam 200C for soft tissue infections. Your abscesses internal that will cause sepsis and kill you can be easily treated with Hepar. Question?
No. Sorry, I
Okay.
have not muted.
All right. If you have sepsis, pyrogenium 200, first line agent. If you have microorganism specific diseases, for instance, typhoid fever, the classic combination is Baptisia 200C every 2 days, twice a day, and Lycopodium 30C twice a day.
What is sepsis?
What's that? Oh,
What
septic.
what is sepsis?
Sepsis is when you have an internal infection inside your body, blood infection, and it travels through your bloodstream and you can die in 24 hours. Pyrogenium, which is a homeopathic remedy made from rotted meat, is an excellent remedy. And it'll work better than a lot of drugs because frequently you have MRSA these days, which is resistant to all antibiotics. The rate of people who have died from sepsis from MRSA infections today is very high in the US. And homeopathy will save you.
What is MRSA infection?
MRSA infection is methicillin-resistant Streptococcus aureus infections that do not respond to your standard antibiotics. And so they do a cocktail of drugs, and even those don't work. And you acquire them in hospitals. So that's the gift you get from going to hospitals. So avoid hospitals when your immune system is down. You did a very smart thing, Sunshine. So that is it. That is that. And if you have no questions, I am going to stop the recording, and I need to figure out how to do it. Stop recording.